Enhancing percutaneous access, the GENOA Prone Modified Position. Percutaneous nephrolithotomy is the preferred technique for managing patients with large or complex renal stones. However, there is still debate regarding the optimal patient positioning, traditional prone versus modified supine. The prone position allows access to even the most posterior calyces. On the other hand, its applicability is limited in obese patients and it presents greater challenges in terms of respiratory management, making it less favorable in certain clinical scenarios. The supine position, while more manageable from an anesthetic perspective, limits the available renal access window and may restrict access to posterior calyces. To address the limitations of both approaches, we developed a novel technique, the GENOA Prone Modified Position. In this approach, the patient is placed in a prone position on the operating table. Gel pads are strategically positioned at the thoracic and abdominal levels on the contralateral side of the kidney to be treated. This setup tilts the body axis approximately 45 degrees relative to the table, aligning the renal axis parallel to the floor. As per standard protocol, anatomical landmarks are identified and marked. This modified orientation enables percutaneous renal access along an axis parallel to the ground, facilitating direct puncture of posterior calyces. Post-lithotripsy, residual fragments can be removed more easily due to the shallower angle of the working tract, similar to what is achieved with standard supine access. Additionally, the axial rotation of the body shifts intra-abdominal viscera medially, driven by retroperitoneal pressure, thereby reducing the risk of iatrogenic injury during puncture and tract dilation. This rotation also improves thoracic expansion on the contralateral side, minimizing ventilatory difficulties commonly associated with conventional prone positioning. Overall, the GENOA Prone Modified Position proves to be more ergonomic, with reduced postoperative discomfort in the scapular and cervical regions. As in the supine approach, the lower and ground parallel orientation of the puncture axis enables a seated working position, improving surgeon ergonomics and the accuracy of instrument handling. 3 patients were treated, primarily on the right side. 1 patient was affected by horseshoe kidney. The mean BMI of 23.8 kilograms per square meter and the mean stone volume was 3.5 cubic centimeters. No patient had hydronephrosis or a history of previous surgeries. Puncture was performed below the costal margin in all cases, with access to the lower calyces in 4 out of 6 cases. No patient required more than 3 puncture attempts. The mean operative time was 70 minutes, with a stone-free rate of 2:1. All patients used analgesics, while none required opioids. The GENOA Prone Modified Position offers a safe, effective, and ergonomic alternative for percutaneous renal access. Preliminary outcomes suggest it can be easily adopted and may improve the efficiency of percutaneous nephrolithotomy. Further studies are required to confirm its long-term efficacy and reproducibility.